show, we are visiting Alliance Healthcare Professionals, and they have chiropractic and other disciplines here on site at 232 South Service Road in Oakville. We're here today to visit Dr. Davis. Let's go inside and talk to Dr. Davis. Dr. Davis here at Alliance Healthcare Professionals, and it's nice to be here. Thank you for speaking to us. Tell us a little bit about Alliance Healthcare and how it evolved and how long it's been in this area.
It's actually been in this building for 3 years or so. Prior to that, it was on the and at that time it was made as the chiropractic. And then Dr. Roper and Dr. Higgins, who were the two partners and two of the chiropractors in this practice, decided they wanted to open a larger multidisciplinary clinic. And so what they did was found this building and they started Alliance Healthcare Professionals. And what we have are 3 chiropractors, including myself, Dr. Roper, and Dr. Higgins. We have 2 chiropodists who are specialists. A lot of times people aren't sure what a chiropodist does, but it's basically like a podiatrist, but that's what they call them in Ontario, and they just don't do major surgeries, podiatrists do.
And what about nutrition? Do you have anybody on staff who deals with those issues?
We certainly do. We have Angela Bassett, and she takes care of nutrition, and she's here different days of the week, so really it's too much time for that. We also have 3 massage therapists here, one here in the males, Kelly, Chubba, and Steve, our massage therapists. We have a physiotherapist who's here a few days a week, and really his friends,
That's a large staff. And it's actually a very big office facility here, so we'll try and do a little tour later, but if you come here, you'll see it's actually a very good treatment center. Now tell us about, we're here at Wellness TV, that's our program. So tell us about what your concept of wellness might be.
Certainly. I have a varied view of wellness because I'm a chiropractor, but I also do acupuncture. And so I have views from both sides of the world, if you will. Wellness to me is taking care of yourself from the inside out. So it incorporates nutrition, what you put into your body has a huge impact on how you feel, which I'm sure you can all attest to. You've been on vacation for a week and eating very much food because you feel as well when you come home as compared to Exactly. Also, wellness incorporates exercise, taking care of your spinal health. That's my chiropractic side, because a lot of times we forget that all the nerves in our entire body come out of our spine, and we take our spine for granted. We take great care of our teeth, we take great care of our eyes, the rest of us, but we forget, you know what, our spine is really important. So what happens is if our spine isn't in proper health or proper alignment, it can affect the nerve flow to different organs and to the rest of our body.
That might have some good news.
It certainly does. They've actually been able to prove in different studies that when you adjust, it can boost your immune system to make you healthy and allow you to fight off diseases. And the acupuncture, although I do treat a lot of specific conditions, it can also help with general wellness, and it helps boost your immune system. It helps if you have any pain because you've been able to study it and determine that it's released from your body. What I do is I use needle acupuncture, and needles, I'll show you one after.
Okay.
But what they are is, they're very tiny. A lot of people who are scared of needles think, oh, is it going to be like getting a shot? Well, it's not. They're about the size of a hair, and they're very tiny, and I put them in specific areas. Actually, here's a model showing all of the different acupuncture points there are on the body.
Wow, that's a lot.
Yeah, so for treating wellness with acupuncture, there's specific points that help boost your immune system and make you feel better. And as far as Chinese medicine, allow your qi or your energy to flow properly. I also do the needle acupuncture with electric stimulation, and I also do laser acupuncture.
Laser, how does that one work?
Well, they have it set for the same megahertz as what a needle, they were able to discover. A needle vibrates at 8 megahertz. And so the laser is set to a similar megahertz. And you touch different points, acupuncture points, and for a specific amount of time. And the laser actually stimulates that acupuncture point, and you get very good results. Some people, I find, get actually a better result from it, but generally the needles tend to be a little more intense. And so for someone who has a chronic condition or just isn't able to handle that yet, or has a huge fear of needles, the laser acupuncture is a great option.
That's great. And when you talk about stress is a major part of difficulties with wellness.
Yes.
And wellness, of course, encompasses a variety of topics like emotional, structural, physical, all these things.
Yes.
But what are the benefits of getting treatment here at Alliance for people suffering from certain types of negative stress?
Well, what we try and have here is a great positive atmosphere, because I think that's very important. And so we've tried to incorporate that with our great front desk staff and all of us having a positive attitude. So people, when they come in, don't feel continually bogged down. Also, we have many different disciplines here. So a combination of chiropractic. If people need massage, we have massage here. It's a one-stop shop. So you don't have to come for one appointment and then rush over to another appointment and then rush over to another appointment. They can essentially get everything they need, other than homeopathy or a doctor of naturopathy, which we don't have here yet. They can get that all in one place.
So it's a total one-stop natural health facility for people to go.
It is.
Yes. And so we've discovered some of the various treatments available, and it's a great place. I can tell you that I've had some difficulties here with my back in the previous, with some discs in the past, and also with some leg trouble. And I had this catching of a ligament, and it was really causing trouble. I'd go and walk across the street, all of a sudden snap, and I'd be limping around for a couple of days, and it really hurt me. So I came here to Alliance Healthcare Professionals, and I thought, what a great place to visit because of that atmosphere, greeted nicely at the door by Katie or Paula, who's ever at the front desk. And within a short while, I was able to improve, and I don't have that catching of my ligament anymore. My spinal health is getting a little bit better, and I suggest that anybody really has that difficulty to go get assessed. And they have a wonderful assessment treatments here available, or assessment procedure. Isn't that right, Dr. Davis?
Yeah, what I try and do, and what the other chiropractors do as well, is it's not simply someone can come in and they immediately get adjusted.
Yes.
I think it's very important to do a thorough examination. If necessary, we take x-rays, which we have on site as well. And after that, and we also can do an SEMG, a surface EMG, which sometimes we do, sometimes we don't. But what that does is it's just an additional tool to allow us to determine if there's problems within your spine and affecting the nerve flow. And from that point, then I go through the x-rays with my patient, because I think it's key for a patient to see their x-rays and see what they look like on the inside, which we often don't get to do. And then after that, then we discuss treatment options. And I will tell people if I'm not the right person to help them, or if chiropractic is the only thing that they should be doing. And from that point, we can either do other referrals or start with the treatment for chiropractic.
Well, if you can picture me hobbling along when I first came here like a while ago, and within a short period of time from hobbling on, I'm sure you've seen the difference.
Oh, you're doing great.
Yeah.
And I also do a couple other techniques. I do myofascial release in addition to the adjustments, and that way it can also help with the muscular aspect of it, because it's very important that you deal with not only the structural but the muscular aspect, and then your whole body. Like you had talked about with wellness, there's the emotional, the physical, the structural, which is part of the physical, and environmental. And we also have 2 people come in once a month, which I hadn't discussed yet,
right,
that actually do electrodermal allergy testing and live blood cell analysis. And that's another great tool that we have. So for someone who, they might be having some symptoms that are going along with their diet, or a condition that we're just not sure what's going on with that, I refer them to Jan or Shannon Culhay for a Culhay nutritional analysis. And I've had great results, including it's safe for my 2-year-old daughter.
So live cell analysis for allergy testing and sensitivities.
Yes.
Great.
2 separate tests, actually,
Right.
live blood cell and allergy testing.
So what
for
do they use?
sensitivities.
What's the method for the sensitivities?
For the sensitivities, it's called electrodermal testing, and it's actually a machine that's been designed and a computer program. And you have a ground, and you test a spot on your finger,
Right.
And all the 270 foods have been tested, as well as you can get tested for molds and pesticides, digestive enzymes, you name it, you can be tested for it. And it determines the resistance of your skin to different foods. I'll just discuss foods.
Yes.
To different foods, and gives you a reading on the computer, and that determines if you should avoid them completely, if you are sensitive, or if you're fine with that food.
I know in today's occupational health setting, occupational health and safety, there's a lot of concern about molds and stuff like that. So that is something that would really benefit that type of analysis.
It definitely would.
Yeah.
And also for a lot of people with young children, because allergies and food allergies are on the rise. Mm-hmm. And a lot of times people say, how is that possible that these food allergies are all, when I was a kid, you could bring peanut butter sandwiches to school and it wasn't a problem. You can't, because it could kill some kids. Mm-hmm. And so it's a matter of determining other factors that could be influencing their immune system, which are making kids more susceptible to these very severe allergies.
And now there's something on the market I saw advertised yesterday called pea butter, which is not a nut at all. It's not nut, and it's replacing peanut butter in schools.
Yes, it is, which is nice because it's a great source of protein, especially for picky eaters or kids that just are too active to eat. A peanut butter sandwich could be a really nutritional snack, but until they can replace that, it's been eliminated.
That's great. So total health concepts and things that are available out there. Now, before we go and do a little tour of the place, as well as we're going to do a demonstration of a treatment, that's what we're going to do. I thought what we'd do is we'd highlight some of the seminars coming up here at Alliance Healthcare. And maybe you could just kind of highlight some of them for me here.
Certainly. Well, as some of you could notice, I'm actually having a baby in about a week.
Congratulations.
Thank you. And so my seminars won't be starting until mid-April. I'll only be gone for a couple of weeks from work. But on Wednesday, April 20th, I'm doing a spinal health and wellness seminar.
Good.
And I'm gearing that towards new patients or people who are just unsure about what's going on and what chiropractic's all about. And that's from 7 to 8 at night.
Okay.
Thursday, April 21st, there's going to be a healthy skin workshop. It's not done by myself, it's done from another professional in the clinic, and discussing mainly acne, eczema, and psoriasis, and they'll be doing mini facials. And that's from 7 to 8 also. Saturday, April 23rd, I will be at Steps for Women Gym, which is on Niagawa. And
that's in North Oakville for our
Yes, for
viewers
North
out there.
Oakville.
Yes.
And I'll be discussing bloating, weight gain. The topic is bloating, weight gain, mood swings, oh my. So women's issues, PMS, different things you can do to combat PMS.
Okay.
And then also every Monday and Wednesday we have a new specialty coming in here, a new professional, and she'll be doing cosmetic acupuncture.
Wow.
And so she'll be offering complimentary consultations, and for its AccuLift, Electrolift, and dermabrasion. And so it's called Nuance.
Microdermabrasion.
Yeah,
Like
dermabrasion, yes.
Yes.
So it's Nuance Skin Technologies with Connie Huggins, and she's just getting going. So it works very, very well.
Good.
So and then the last thing that I'm doing is a chiropractic mother/parents morning out, and we started going, and then it's fizzled off, and so now I'm trying to get it going for May, and it'll be the first Wednesday morning of every month. And you can come out, you bring your kids, you bring your toddler, your infant, and we'll discuss different activities you can do as far as increasing their development. Also, there'll be an area for discussing health and wellness for your child as well as for your entire family. And I'll be trying to get guest speakers in according to what people would like to hear about. And all of these are complimentary.
And that's a huge schedule, and you are very busy.
Yes, but one of the main things for me is educating my patients and educating people. And it's not just educating them about chiropractic, but educating people on health and wellness, and so they are empowered and informed to make decisions in their lives and to ask questions. I do a lot of talks at senior centers, and my main key for them is ask questions. Because a lot of them don't know. They're on 5 different medications, but they really don't know why. And so I try and empower them to ask the questions so they have the answers, so they know what they're taking, what they're putting in their body, and what can make them healthy.
And education is prevention.
Exactly.
Okay, so why don't we take a little walk down the hall. We're going to go to a treatment room, and we'll show some of the work available here. Okay, we're in the treatment area, and this is one of the rooms that Dr. Davis uses. And I've been kind enough to donate my own x-ray picture here for actual viewership of everybody here. So here I have my x-ray, and some of the problems I was experiencing in the past related to the back and things like that. Can you explain it?
Sure. Well, I just want to let everyone know this isn't the only x-ray we took, because you have to always have 2 views in order to really determine what's going on.
There's an R. It's for me, Randy. There's an R.
R for Randy or for right side,
Yeah.
either one. But this is one of the views I like because it's the full spine.
Okay.
And this allows me to take the second angle for your low back as well as your neck, which are 2 of the key areas I focus on.
Right.
What I've noticed here, also from knowing your history and your other x-rays, is there's a couple areas. First of all, I checked the height of your hips and your left iliac crest, or hip bone, right here. This is looking at you like this. But you have to remember that it's a 3-dimensional image, a 3-dimensional body going onto a 2-dimensional image, so you can see everything through.
Right, okay.
So your left iliac crest, or your left hip, is actually a little bit higher than your right. And you've been having problems with your legs as well.
That's right.
And so this can be partly from your back, but it can also be coming from your feet. So then it's a matter of assessing where it's coming from.
Yeah, that's a foot problem. That's right. Yeah.
And then I also looked at what you want are these right here are all vertebras.
Yes.
Which are the bones that protect our spinal cord.
Okay.
In between each one is a disc, which is like our shock absorber. That's what the space is here.
Oh.
And so when you have a herniated disc or degeneration of the disc, what happens is that space actually starts to narrow. And when that narrows, you actually have more mobility in your spine. And when you have more mobility in your spine, the way it reacts is actually grows bone, because it's trying to stabilize.
And you get that rubbing together type thing.
Well, yes, and that's when you hear about osteoarthritis or degenerated joint disease. That's when the bone has started to grow. Well, what you have here is, I was just looking at some of your disc spaces. This disc space right here, which is your L4, L5 disc space, is actually a little narrow.
Oh.
Coming up here, it's not too bad, but what I did also notice is that your vertebrae are actually rotated to the right, this way, just slightly, and that can affect the alignment. Now, it's not, don't think of rotation as pinching off a nerve, and so you're going to feel numbness down your leg necessarily, but what it does is it can actually just push on the nerve a little bit, and so it can be affecting, causing symptoms that you aren't even aware of yet.
Which yes, and it's very unnatural to have it like that.
It is.
Yes, yes.
Now, it's not to say everyone is perfectly straight, because not everyone is. But definitely you have some rotation to the right in the lower lumbar area.
Right.
But then you come back to center here.
Oh, I see.
You also have some degeneration going on in your mid-back.
Yes.
Right here.
And I feel it.
Yes. And so what you can see is, you notice that the disc space is actually narrowed there. And that is right in this area.
Right.
Now, the important part of this area is all the nerves from this area are affecting your lungs and your heart and your stomach. So a lot of times if there's dysfunction in this area.
I believe there are. I'm having some difficulties. Yes.
Yes, and sometimes people have chronic heartburn or acid reflux. It can be, part of the problem could be actually from their spine. And so that's what's causing the symptoms as heartburn.
Okay, so I ask you,
Yes.
is this a nicer spine or mine?
I have to say, this one's a little bit nicer,
Yeah.
but yours is on its way.
Okay, thanks. It's a little more natural mine than this
Yeah,
one.
but the good news about your spine is you have some degeneration, but yours isn't too severe. So you're here at the right time, so we're able to help you. Because once degeneration has occurred, no one can reverse degeneration. But what we do is try and improve the health of your spine so it slows down any progression of the degeneration. So that way you feel better for longer. Because having those aches and pains as part of getting older, I don't believe in.
Am I getting older? I don't know. I hope not.
No, getting younger, getting younger.
Okay, so why don't we just show a treatment then, a demonstration of that. Okay, here I am on the treatment bed, and this is not a bed of nails. It's rather comfortable, actually. And here I am, and Dr. Davis is going to demonstrate the treatment.
The treatment I'm going to demonstrate, actually the one I use typically on you, Randy, is the activator method.
Yeah.
I do a couple different techniques here. The activator method uses this, and so I find it's great. It's a little less invasive than the manual therapy that people are typically associate with a chiropractor, where you hear the cracking noise. Just so everyone knows, the cracking is actually not your bones cracking. It is nitrogen bubbles forming in the joint.
Everybody thinks it's
the
your bones joint cracking, but it's not.
It's not.
Yeah.
And so hopefully that eases some people's mind. But this is a technique that we found works best for you. So what I do is I start by checking leg length.
Okay.
And by determining leg length, getting Randy to do different movements throughout the treatment allows me to determine what's going on in different parts of your spine.
And that doesn't hurt at all.
It sounds like a staple gun, but I promise it doesn't hurt. I find it's really great for pediatrics and people who are very osteoporotic as well. Now I need you to put your right hand in the small of your low back.
Okay.
And you can put it down, back where it was.
Okay.
And your left hand. Right now I'm assessing Randy's low back and down.
Okay.
Turn your head to the right. And straight down. And turn your head to the left. And straight down. And just to explain, after Randy after you turn your head and I bring your legs up, I'm looking actually for how level your feet are. And whichever one's longer allows me to determine what side there's some rotation to. And this is just oversimplifying the technique, but just so people can understand.
Okay. So you're doing this, and it doesn't hurt at all, but it actually is helping to readjust.
It is. It's realigning your spine just very gently. Lift your head straight up and put it down.
Which is a lot more, I don't want to use the word violent, but it's a lot more aggressive than some of the other conventional methods of readjustment.
It can be. Tuck your chin to your chest. But as I said, I do perform a lot of manual therapies as well.
Yes.
And some people respond much better to it. And for all of the viewers, the manual therapy actually, we went to school for a long time, so it is.
Right.
We are very well trained as far as what force to use and how to use it.
I can tell you I prefer this one rather than the other.
Yeah, rather than the other. And for you, we also sometimes do manual therapy on your mid-back.
Right.
Which today, do you mind if we demonstrate that?
No, go ahead.
Okay. I want you to take a deep breath in and all the way out. There we go.
I heard it.
Yeah. So
Okay.
that's just pretty gentle. And we've adjusted your entire spine now from your pelvis all the way to the top of your neck.
That's terrific. And it was really pain-free. I felt no problems with that at all. So that's the beauty of chiropractic, really.
And just to demonstrate quickly what I do for your leg, what we've been working on is the myofascial release. And so what I do is I actually take a point on Randy's calf and I hold it with my thumb and I push his foot down, and what that is doing is actually elongating the muscle or taking it through its range of motion.
Wow, that's tender because that's my sore leg.
Yes.
Yeah.
Well, I wouldn't want to do it on your good leg. And so that way, it's stretching it out and allowing the leg to function properly. And Randy's been very good, of course, for doing all of his exercises
I do my
and
stretches. Ouch.
that I give him. And that's a huge part of the healing, is the patient's commitment to actually doing the exercises that are given to them.
And that has some psychological benefits too, because if a person can assist in their own treatment, that's actually very good for their overall health.
It is, because it's very important. Although I love seeing my patients all the time, my goal is that they don't have to depend on coming to see me to feel better, that they can do things on their own to maintain their health. And still a lot of people choose to come in once a month, once every 6 weeks, just to make sure everything's in alignment and so that they are feeling at top of their game.
Okay, so that's it for the treatment portion.
Yes.
And now we're going to move on to the next phase of. We're back in the office with Dr. Davis, and you're going to explain some acupuncture needle therapy.
Yes.
Yes.
First of all, I just wanted to show what the needle looks like. But the needles I use are all individually wrapped. They're pre-sterilized. So I open them up, I use them once, and then I dispose of them.
Right.
Okay, so a lot of times, especially after the news programs, about 6 months ago,
news about those things.
in Montreal, that people were reusing needles. There are acupuncture needles you can reuse, but you autoclave them.
Right.
But I don't see the point because really they're quite inexpensive, and for the hassle of doing that, and then they get dull. So I just choose to use the disposable
For security
type.
standards, and it's better to use the disposable.
Yes. So what I'm going to demonstrate is just putting a needle in to you, Randy.
My first time ever getting acupuncture,
yes,
folks.
we've never
Here it
done
is.
acupuncture. So I just clean the area with a little bit of alcohol. Not really it's be very, very difficult to get any infection from an acupuncture needle from your skin. You can't get it from the needle. It's stainless steel. But I like to do it if someone, especially if someone is HIV positive or is immunocompromised, just to make sure that they don't.
I'm healthy, folks. I'm healthy.
Yes. But this is just to show the technique I would use. And then I take the needle out.
Yes.
Just so you can see it. See how nice and thin it is?
Yeah.
Very, very
I don't know if you
tiny.
can pick that up on camera, but it is a very, very thin needle. It's about, what, 2 inches long?
Yeah, this one.
Yeah.
And the important thing to know is that the needle actually doesn't go all the way in. So some needles are quite long to use for larger areas such as the glutes or the hips,
right.
Where there's a lot more soft tissue. But they don't go in a lot of the time. This one I'm putting into LI4, large intestine 4. And I put it in a little bit further.
Yes, so it goes in, and for each place you put it, useful for various parts of the body where you get elements, energy fields, meridians, that type of thing.
Meridians, yeah. There's 12 meridians in your body, and they run from the top of your head all the way down to your toes. And so sometimes if a person comes in for a condition such as low back pain, there are points actually on the bottom of the foot that are a little tender, but they are great for low back pain. But I'll also put one in LI4. I'll put one right on the side of their baby finger, and that's great for relaxing skeletal muscle. So there's points all over your body. It's not just the area of pain.
So this is an option for me if let's say, I develop more back problems, or perhaps you wanted to supplement my current treatments.
Definitely.
Yeah.
It certainly is. And so what we do is there's 2 ways to stimulate the needles. I can just spin them.
I can feel a little bit when you twist.
Yes.
A little bit, yeah.
Spin it, and that just helps stimulate the point, or I use my electro acupuncture. So hook it up to a stim unit, and I turn it up to your tolerance, so it's not painful. And it's like a pulse that constantly goes through the needle, and that sort of supercharges the point and increases how often it gets stimulated.
Okay. And very useful for sports. I see a lot of sports therapy therapists use this.
Yes, it is. It speeds up healing. It also decreases swelling dramatically. Some of the current things I've been using it for is actually I've had some great success turning breech babies using acupuncture.
Really?
There's a chiropractic technique specific to turning breech babies, and also using acupuncture, or a lot of people have heard of moxibustion, which is using heat to turn the babies on acupuncture points. And I use the acupuncture with the electricity hooked up to it. And so the 2 patients I've used it on recently, both their babies turned at 38 weeks.
That's true.
And that's how I used what I used to turn my daughter when she was breech, my first child.
Really?
Mm-hmm.
So is this a similar type of concept to maybe, let's say, TENS unit, a transelectrical nerve stimulation?
As far as the electric pulse, it is similar. The machine looks very similar, but it has little alligator clips that clip onto the needle, and then that puts the pulse through. And I have it set for 8 megahertz, and so that's the difference between the TENS. But as far as if someone had a TENS unit, you could use it for the acupuncture to stimulate it, but what you'd have to do is just change the settings.
Okay. Well, thank you for showing us.
You're very welcome. I just need to get a Kleenex, and we'll take that off and put it into our biohazard container.
Always safety first, right?
Exactly.
That's right.
It's very important.
Okay, in our next little area here, we're going to go on a little tour of the clinic. We are now in the active rehab area of Alliance Healthcare. And Dr. Davis, tell us what goes on in this room.
Well, this is where our physiotherapists and our athletic therapists do a lot of their work. And especially if someone comes in after a motor vehicle accident or a workers' compensation case, we have different equipment here that can actually assess and give us very exact numeric values as far as range of motion of their neck, their low back, and they do a lot of their exercises in here. We have a treadmill, we have a stationary bicycle. They can do some of the weights that are required for their treatment. This is one of the machines we use as far as determining range of motion for the neck, and they can also do some of their exercises using this. And very exact. It works quite well. We also have some other weight machines. It's not used as often. And then we have our stationary bike and our treadmill. So it's quite comprehensive as far as what can be done in here. And then we have mats for them to do their exercises.
That's great. So this machine here, my guess is that you would use it for maybe somebody who's had whiplash. You want to find out the extent of their damage, and maybe see how much they can move their neck.
Definitely.
Yes,
And also
okay.
someone who has a chronic condition and their neck has decreased in mobility, this gives a great assessment tool for determining, okay, where are they at the beginning? It allows them to do some of the range of motion exercises, and then also you can reassess on a continual basis.
That's terrific. And it looks like it's wow, it must be quite a busy place, especially with occupational health and therapy and all the
Yes.
companies sending their employees through to return to work programs.
It is, and we also have resistables, and we have core stability exercises and core stability home programs that are taught here as well. And so that allows people to work on core stability, which is key right now.
Yes.
Because our bodies, I like to call us a chair and table society. And so for our entire lives, we've been sitting in chairs with back supports.
Right.
And so we don't have the ability to use our core muscles the way, if you look at any tribes in Africa who don't have chairs. And you can look at the elders, and they're able to sit up on the ground without any problems.
Because I've learned posture.
Exactly.
Yes.
Whereas we, if we're sitting for too long on the ground, all of a sudden you notice people start leaning back, and then they have to lay down because we don't have that core stability.
Yes.
And so some of the exercise programs that we teach here will help build up that core stability so you can maintain your spinal health and your overall core health.
That's interesting because you know when you see people and they sit down, like when you're little kids, you have time out or something, or you have in kindergarten class where they all sit down in groups and they cross their legs.
Yes.
I cannot sit and cross my legs. My legs are too short. So
No,
how do
it's
you
a
do
matter
that?
of flexibility.
Flexibility. Okay.
Yeah, kids have the flexibility, and they also have the muscle strength that we don't have unless you constantly work at it. And that's why Pilates is so big right now, and
Yes.
yoga, because they really focus on the core stability. But you also have to make sure that your spine is in alignment and everything else is in alignment to maintain that core stability, because if it's not in alignment, it makes it a lot more difficult.
Huge impacts on wellness.
Yes,
Yes,
definitely.
Absolutely.
So this is a really great section, and we're very happy to have France and Jason here
Great.
to implement this aspect of people's health.
Great. Now we're going to see the rest of Alliance Healthcare. Hi, we're down at the other end of the wing here at Alliance Healthcare, and we're going to visit some of the massage therapy areas now.
Yes, we have actually 3 massage therapy rooms, and in here is also where the acupuncture and the acupuncture facelifts, cosmetic facelifts.
Wow.
That occurs in this room as well. And this is one of our massage therapy rooms. This is Chubba's room, actually.
Now this is a room I could, because the massage is so relaxing, I could spend a lot of time in here. I could just relax and...
Many people do. Many people do.
Yeah.
And so we have our 3 rooms right here, and then we have our 2 chiropody rooms.
Right.
And so this is where Salima and Vanessa do their work.
Okay.
And we'll be talking with Salima.
We'll come back and speak.
talking with
We'll come back and
Vanessa.
speak to Vanessa because I know she's here today.
Yes.
Yes. Okay.
And so then coming by here, we have 3 washrooms, and we also have shower stalls in 2 of them. And so that way, if people come for a massage
Right.
while they're at work, they're able to have a shower, so they're not going back all greasy, which is nice.
That's a nice thing. Nice to be able to have that, especially if you're working and coming to the office after.
Yes, and
That's
this is
very
our physiotherapy area,
Okay.
and also where we do acupuncture. So there's 2 tables that I like to use for the acupuncture as well,
Okay. That's very important.
and my office.
Yes.
And
We're
then-
heading out towards the desk now, the front reception area.
Yes, and I just wanted to show
Sure.
right in here
Yeah.
the physiotherapy. We also have an anatometer, which is this table right here.
Okay, what's
And
an anatometer?
What it does is actually people lay on it, and it does intersegmental traction. And so they just lay down. We set it for a different height,
Yes. Yeah.
and there's rollers that go up and down the spine and cause intersegmental traction, and you can set it very gently. And a lot of people find it quite relaxing.
Traction.
Yes.
Interesting.
Very gentle traction.
Okay. That's interesting for me to
And then
remember.
let's go look at the chiropractic.
So now we're in the chiropractic area of the clinic, and Dr. Davis, tell us about all the treatments here. What happens?
Sure. Well, Dr. Huggins and Dr. Roper, their offices are down in this
Right.
section.
Right.
And then we have 4 treatment rooms. One's the exam room, which everyone's already seen, where we did your treatment.
Yes.
And we
And
do
it feels
take-
like a success. I feel much better.
Oh, good.
Yeah.
Good. And then we have 3 rooms that are more geared towards activator treatments.
Okay.
And we can go into this one right here.
Now this is a special type of treatment bed here. I see here.
Yes. And what this does, I'll just lift it up. It's actually
It's automatic.
Yes, and so it's standing up, and this is great for when people, and the other table does this as well. This is great for when people are very cute and it's hard to get on and off a table. And so they come and they can stand, and then we can just lower the patient down.
Gee, maybe after those hard weeks at work, I should get one of these for home, and I can go home and lay down. I can do all the movement. I can just relax.
A lot of people say that. They say, oh, I wish this could get me up in the morning.
Yeah.
And so that way they're nice and set, and then we can do the treatment and then bring them back up.
Great. That's very...
And we have lots of information out for the patients as well, and different handouts to highlight things that are coming up, or this is one of the papers I designed for talking about why children should have chiropractic care.
Yeah, it's important for children's health overall.
It is,
yes.
It is. And so coming out, and this is the way 3 of our treatment rooms look, and then the other one is the exam room that we were in already.
Yes. Okay.
And then you just walk in and you get to come to the wonderful reception area.
Great. So this is actually a huge reception area, and how many staff work here?
Do you want to? Depending on the day, but we have Paula, who does a lot of our. She's in charge of the front desk staff, and she also does a lot of the motor vehicle accidents. And Josie, who's in charge of workers' compensation, also is one of our front desk staff.
Okay.
And this is Shannon working hard on the phone. We also have Lillian, but she's on maternity leave. She just had a baby boy
good for her.
yesterday.
That's nice.
And Sandra, who is also one of our front desk staff, and then Katie, who you had mentioned previously.
And every time I phone, every time I come into Alliance Healthcare, I find that the people here are not only very friendly, they're very helpful. They help you relax. So even if you're feeling a little bit of pain or a little bit of discontent with the way your week's going and you have a build-up of stress, they help you relax even before you get into the treatment room. That's an important thing.
Yeah, and we have the displays for the shoes for the chiropodists, for their orthotics, and then a range of supplements and different creams that are great for anti-inflammatory creams and pain-relieving sprays and digestive enzymes. So it's quite comprehensive what you can get here, and we're trying to even extend our vitamin section more.
So there's a full range of products available here too.
Yes.
Okay, so now what we're going to do is we're going to talk to Vanessa, the chiropodist, and we're going to be asking her about some of the treatments she provides here. We're in the offices of Vanessa Pontet, and she's a chiropodist on staff here at Alliance Healthcare. How are you today?
I'm doing great, thanks.
Nice to join you here today. Tell us what you're going to do for me here today as part of your demonstrations of foot care.
What we're going to do today is we're going to take a pressure imprint of Randy's foot just to see any abnormal pressures. When we're looking at abnormal pressures, we're looking for different calluses, because calluses are an indication of the way the body protects itself. So when you get really thick calluses, they become a problem and become sore. So what we're going to do is we're going to take a pressure imprint and see if we have any of those abnormal pressures.
I have a lot of pressure, and sometimes I don't realize it's just the foot. But as a diabetic, actually, Vanessa, as a diabetic, I know foot care is very important, especially for circulatory reasons and also protection of lots of limbs and things like that. So it's actually very important for people to come in here and get assessed, especially if you're diabetic on a regular basis.
Exactly. We always recommend that if you are diagnosed with diabetes, to come in at least once. Come in to do a full assessment. We'll do circulation. We'll check for what's called neuropathy, which is a sense of loss of sensation in the feet. The nerves in the feet are very, very sensitive. It's one of the first places that are affected with sugar level. So we do a test for that. And we look at your footwear and we look at your lifestyle and see how your feet are and making sure that they're comfortable. And then we decide if you need to come in regularly or if it's just an annual checkup to make sure that your feet are happy.
And while we're on the subject of that, with diabetics too, it's important for them to really check your blood sugar levels to be able to determine if you do have high blood sugar levels and how it can impact the rest of your body.
Exactly. The feet are very sensitive. Sometimes the feet are, especially the sugars are high. Some patients will experience burning or tingling. I would recommend if you are feeling that, check your sugar levels because it could be that they are high.
So basically, I could be found out today that my sugar levels are a bit high based on my feet.
Well, and if you're having any burning or tingling, that's a real indicator.
No, I'm lucky there.
Okay, good. Feeling good? All right. What I'm going to have you do is I'm just going to have you step on the ink pad, put all your weight on, and then step off.
So it's
We're
like
going to do it on the black box.
Okay. On the back.
Yep.
Okay.
Great.
Well, look at that. Went right through to the pad.
You see that?
Yeah.
And no ink on your foot. So you can,
There's no ink on the foot?
no.
Wow, look at that.
See that?
Okay.
Nice and neat.
Okay.
And see here we have a well-defined arch, but in the ideal foot, this should be all the same shape. Okay? The only heavy indication is you're heavy on the first metatarsal head, so that area is quite heavy. And also, when you're walking, you can see that instead of toeing off straight, you're toeing off more towards the side.
So it could be that maybe some areas are feeling more pressure now.
Exactly. And if you look at your foot, you can see the lower top. And you're a bit heavy on the heel too. So what we want to do is we want to address why are you getting those pressures and how we can relieve it and the chemical calluses and so
Good. So what's a demonstration of doing self-care?
well, we could do actual treatment if you wanted to put up to reduce the damage. We have some powders that can be used.
Want to see my callus out there? I don't know if they do.
They want to see that or not.
Yeah. Okay, so a normal course of treatment, you would remove that,
Yes, you would.
and then you would apply a callus.
Yes. Well, if we decide that treatment-wise we need to make an orthotic, the best way to capture your foot is by doing a plaster-Paris cast. We have an example of one here. It's a bit of a messy process, but it's the best way to capture your foot because there's a lot of individuals making the callus, but if you want to have a plaster-Paris cast, you don't capture the two dimensions of your foot, and that's the best way to capture your foot and make the best correction.
Okay. So due to time limitations, we won't remove the callus today, but now gives us a better idea of really the process of how people have to take care of their foot and the impacts of how to do that. And that can impact the chiropractic care as well. Okay. So that is our visit to Alliance Healthcare Professionals today here in Oakville. I want to thank people who have been so kind to allow us in for the TV show. Dr. Gemma Davis, thank you. And just a reminder that Wellness TV will be out next weekend at the Total Health Show, and that's at the CME. So look forward to further segments from that show. And remember, Alliance Healthcare can be reached by phoning 905-845